Good evening, everyone. Good evening. Hello, hello, hello. Hi, I am Christine and I am here. This is day 2 of looking at how you are able to really expand on your healthcare business. I hope everyone can hear me. If my team can let me know that you can just hear me okay, and that you can hear me fine, and let me know that the sound checks are coming up okay. And welcome everyone, welcome. And I'm Christine Crowell. I'm the founder of the group here, and I just wanted to talk to you. We did day 1 yesterday, and we covered some aspects of the training, what I'm about to do today. Let me just have a look here. Sorry, because I can't see the messages, so you can hear me clearly. Wonderful, excellent. So hope everyone's doing well. So let's get into it. So today, really, I want to talk to you about how we can, as care providers, really expand our growth. And today is about living beyond the horizon, really stretching ourselves as care providers, looking at, dare to dream aspect. And this is day 2. We did day 1 in the event page, but for some reason the event didn't happen in that page for day 2, so that's why I'm here in the main group page. So this is also going to be able to be watched at a time that's convenient for you. So I hope that's going to be good for you. Let me know if you're watching it now or whether you're watching the replay. And I just want to reach out to you about when you're looking at building your healthcare business. We're in 2024. So we've got to look at how we can expand our knowledge from what we've learned in the previous years, for example, and looking at what new foundations we can build into the new year, the new types of healthcare businesses that are coming about through the transformation over the couple of years since we've been doing a lot of online activity as well. So today's training will go into that. So what I want to talk to you today is really about what we are missing. What is missing from what we're currently offering at the moment. And you might be able to resonate with that and say, yes, I have a few things missing. You will be able to really look at how you can expand your organization as well. And I just wanted to really come forward with you on this as well, just to go through what it is that you can do as a provider and think about what you've got missing in your healthcare organization to really grow your business to where you need it to be. So what do you have missing? What is it that you feel that you've got missing? And when we come to the end of our training, today is our day 2, but we do have training which is tomorrow and Friday as well, which is to do with how to sell your offers. If my team can also put in the link to the event page for those that haven't registered already, I would highly suggest that you do register. So let's get into it. So hi, I'm Christine Crowell and I am the founder of the page, and I really want to really expand your awareness of what's going on and what you possibly might have missing in your healthcare business, because we tend to follow what we see people are doing that we think is really successful, but really we don't know how successful that is. A lot of people are hiding things from you, not giving you the facts about what running a healthcare business can be like. So what do you have missing in your healthcare business right now, for example? What is it that you feel that you could even look at and say, you know what, I have this lacking at the moment. I'm lacking this, or I'm lacking that. So we're going to deep dive into some of the things that you may have lacking in your healthcare business in order to really bring it into 2024 and beyond, because we need to look at the horizon and beyond that horizon as well. So growth in healthcare is so important, and I'm sure that's what you all want to do. You want to grow your healthcare business, and I'm going to talk to you about some strategies which you can use to help you grow your healthcare business as well. And it's important that you really think about this, so you may need to get, a pen and paper, write things down, get your pen out, get your notepad, write things down so that you're taking note. Okay, but also remember that this is also going to be available in the group as well. So who is it are you serving? Who do you serve? Write this down. Who is your ideal client? What is your ideal client looking for? What type of business are they looking for? So what type of client would you, for example, be that's going to match the client that you want to work with? Whether it's private, whether it is governmental, i.e. the councils, the government, the NHS, for example, who are you going to serve? So then what you need to think about is, I talked about in day one, I talked about in day one about looking at the 2% method. And the 2% method is a blueprint that I've provided and in my training, where I talk about how you, the provider, the supplier, can be a buyer, would be attracted to your services because you have got a specialized service that you're providing. For example, I'm going to talk to you about what I've mastered, and it took me 7 years to actually realize this. 7 years for me to realize this, that this method is a lot better than the higher volume. The high volume is fine, don't get me wrong, but long term you want to also look at increasing your margins so that you're getting profitability as the care provider, because that is important as well. Okay, so what I discussed and what I am discussing now is that you can get higher rates. For example, if you was to take on self-employed contractors like locums, like doctors, they're the ones with the higher rates, right? Managers in healthcare, that's a higher rate. Consultants in healthcare, that is also a higher rate. And service managers in healthcare, for example, they get 50k to 120k depending on who it is and what type of organization they're working. And if it's the UK, then usually it's about 50, 70k a year for a service manager, for example. And then for the US, it's about 120k in the US. So think about supplying temporary staff members to organizations like the US, for example, and the UK. It all depends really, okay, where you're based. Because if you're providing a higher rate, then that's like £1,000 a week just for the service manager if you're in the UK. Then you got your percentage on top that you would charge. So if you was to break that down as a 40-hour week or 37.5-hour week, for example, then you then put your charge on top, which would then be, for example, 65 to 70% of that hourly rate. So your margin is a lot higher than having someone who is a healthcare worker, for example, and they are, you're getting, say, £3 on top of their hourly rate that you're paying them. So think about your margins, because the work is just as hard as providing a high rate staff agency than it is a lower rate staffing agency, and the work is actually more. You know, there's a lot of pieces, lot of moving pieces to this, as opposed to having a locum doctor, for example, 12-hour shift, which, you know, is, you know, say £150 an hour, for example, as opposed to a healthcare worker who is £15 an hour. What do you prefer? What would you prefer as a business owner? If you can also put in the chat that you're watching the replay, and if you're watching the live, then, you know, what do you prefer to do? Our time is so valuable. Life is short. We've seen what the pandemic has done. People have lost their lives. Our loved ones, we were ill. We're still getting ill from this. So what is the rates and the margins that you would prefer? The higher rate or the lower value rate, but you've got volume? Okay. Another thing you could do is mental health nurse. You could specialize in mental health nurses, supplying only mental health nurses. And that could be £44 an hour up to £75 an hour, depending on the location of where you are at. Okay. There's also scrub nurse. There's also live-in care, complex care, providing specialist service. Therefore the rate is higher, because sometimes they will require 2 people there, for example. Okay, so just think about, get your pen and paper out and think about who it is that you want to focus on looking at serving. I mentioned yesterday about having your mission and your vision. So create a new mission and vision, and there's training on that as well. Okay, I'll just grab my water. So I hope you're enjoying this learning. So go for the higher rate. Let's look at this, delve into it a bit more. So for example, if you was to have a neurosurgeon in your agency, for example, and you'll see, if you look on, there's various websites, you can look at what the salary is for a neurosurgeon, because they're very hard to find, because they're so specialized. They even travel worldwide as well, because they're so specialized. So salary.com, for example, neurosurgeons, they can earn anywhere between, you know, £501,000, to, it depends what percentile they are as well, up to 843,000 at the higher level. And that medium salary is between $666,000 a year. In the UK, it ranges from 99,000 a year plus. It all depends who it is you're working for, whether it's a private hospital or private clinic, for example, or NHS. All really depends, really. So wouldn't it be better to look at placing highly specialized staff members with organizations, because there is a shortage, a massive shortage. And this isn't just in the UK or US, it is worldwide. Especially a neurosurgeon, they're traveling around the world. They have to, because there's a shortage. They need to be there to try and help save lives as well. So I just wanted to point this out to all of you, to think about your agency, whether you introduce one of these models that I'm talking about to you today is excellent, or have this as your 5-year plan. that you're going to introduce some new higher level each year, for example, and make that work, and then you do another one so that you know you don't feel overwhelmed, or you just specialize in just one thing, because that can get you a lot faster and quicker to where you want to be than trying to do all these different things, because that takes skill, it takes time, it takes operations, it takes planning. All of these things do take time, but if you focus on one, then you will grow a lot faster and quicker as well, and you'll be known as the go-to expert in this. So if you're liking what I'm saying here, you know, give me some hearts, give me some love, let me know that you can hear me clearly and that you're understanding what I'm saying. You know, do you want to be the agency that is providing the higher margin, or do you want to continue to work in the lower value contracts? And I was, you know, I've been there where I was providing the lower value contracts, and I'm not saying it's not a good thing, but in today we don't need to be working so hard that, you know, because care providers can get burnt out as well because you're exhausted. You have to put some skin in the game. I'm not saying that when you just start out, you have got to work hard to get your business off the ground. You can't just expect it to just happen and you're not working it and knowing how to work that business. But I'm also showing you some strategies that may fit in better with your lifestyle. Okay? It all depends. It really is up to you what you want to do. But I'm here to show you the multiple seven-figure model, even the 8-figure model as well. The 2% of people that are doing this. Okay? So like I said, the neurosurgeons are very short. They really are very short of staff, and they do need specialist qualified neurosurgeons. So think about that. You can put that on your list to get yourself growing within your healthcare business, because this training today is about growing your healthcare business. And how best can you grow it is by becoming specialized and not being the average Joe Blogs agency out there that's doing what everyone else is doing. Be different. But also going into further training today, you know, is about what your community needs as well. And I'll go further into that as well. So another one is patient care technician. And that is whereby you've got CNAs or healthcare assistants, for example, and they are watching monitors with these specialized robots in certain wards where the patient is critically ill or they're at risk of wandering or falling. There's multiple reasons why this is. So they will have like a patient care technician who is sitting at a desk at the hospital, and they've got several monitors, and they're watching the wards that are, the rooms that are vulnerable, for example. And then if a patient is about to fall or stands up, then the carer goes in to help at the right time. That's what's meant to happen in theory. Don't quote me on this because I don't want to get too technical, because that is a whole nother show ready for my podcast show, which starts next month, and I want to be able to discuss that with you in a way that is going to match that podcast. So my team have just said something. I'm not sure whether they did or not. So patient care technician, like I said, is a really it's a new thing in the UK, but it is in America. A lot of hospitals have them, and it will be where there's one carer, for example, just sat at a ward station, and then there's multiple screens around watching each of the private rooms where patients are who are critical or at risk of falling, for example, or vulnerable. So, what are the primary job duties for the PCTs? The day-to-day work of a PCT could include any of the tasks expected of a CNA or a healthcare assistant. Okay, they may do administrative tasks, for example. They may do different things, like in America, in CNA, they do specific medications, they draw blood for lab work, for example. They can operate some medical monitoring equipment, begin with discontinued catheters, for example, perform and manage wound care, remove stitches, staples, etc. These are for PCTs, they are trained, okay? So the day-to-day work of a PCT could include any of the tasks expected of a CNA. So they're not just sitting there all the time, they're, you know, kind of, they can be like wandering around doing different tasks. However, from what I've witnessed, they do seem to be sat in one place. Okay? So it all depends how big the hospital is and how busy they are as well. So think about what new methodologies you can introduce. You could introduce travel nurse agency. That is a higher level as well. And I want you to all think about what higher margins can you create for your business so that your business is scalable and it is also going to be beneficial to all, for the staff members, to the patients, better outcomes, for example. Not saying that the lower values that the patients get bad outcomes, because they still get good outcomes. But I'm just saying, for you as the care provider, you can work smarter, not harder. And this is the reason why I'm doing this training, because I want to enlighten all care providers that there's ways around things where we don't have to work so hard to the point where we're not having a life for ourselves. So learn about revolutionizing your patient care and improve your operational efficiency as well. So improving your operational efficiencies in healthcare sector, it does require a multi-pronged approach, pronged attack, for example. Focus on integrating innovation, technologies, and adapting new care models, and implementing efficient operational practices which you can introduce. So telemedicine is a good one as well, and you have to look at that to see those types of platforms, to see whether that is something that you want to do as the business owner. Okay, so virtual healthcare is really becoming popular. It's expanding as well, so you need to have access to care through telehealth platforms, reducing the need for physical visits, enabling remote monitoring, consultation and follow-ups. And this is happening all around the world. So it's not new. So another thing that you can think of is looking at what leads that you can get. So what training can you offer? What training can you offer? It's important to look at this, because you're not just running a healthcare business, but what else can you offer that's going to be beneficial for your staff as well as for those that use your service, or even the community. I had a training school many years ago, City and Guilds Training School. What I would do now, if I was to do an agency now, I would do a training school again, but what I would do is I would go into the community of where I'm providing the service, and then I would offer, for example, at a community centre, I would offer to do training, whether it's for carers or whether it's for those at the community centre. Maybe they have activities on a certain day for the elderly, for example, or maybe dementia. You may be able to do some high-skilled training for mental health or dementia, for example. So think about what other things you can do as a care agency. I hope this is resonating with you. Let me know in the chat box, because I want to hear from you whether this is going to be helpful for you to decide introducing something new into 2024 for your healthcare business. And what you need to do to succeed is you have to become a warrior. You have to be a warrior. If you want to run a successful healthcare business, a care business, you need to be a warrior. Because there's going to be times where, sorry, I thought I was getting a message there. There's going to be times whereby you're going to need to be strong. You're going to need to be able to be a warrior in your healthcare business in order for you to succeed, because you will be faced with challenges. You're going to feel frightened, you're going to feel fearful, but that's all part of growing. It's all part of overcoming that challenge in your healthcare business so that you can be the leader that you are. You have to lean into it. I say lean right into it and accept it. Overcome it, and you will feel stronger for it. It's like you climb a mountain. You get to the top of that mountain and you feel so proud because you can see this beautiful, beautiful view. And you think, wow, I've climbed that mountain. Look at what I've achieved. Yeah, exactly. You imagine sending your healthcare workers, even specialized in going into the neuro wards. There's neurosurgeons, but there's also the staff that work within that department. There's a very, very shortage. There's a shortage, of staff that is to do with the neurology, the neuro wards. But the neurosurgeons, wow, they're very hard to get, and they have to move around because they're in so many. They could be in 3 or 4 hospitals at a time because of the shortage. They're constantly, their bells are going off all the time. They're having to go and check things all the time. So you could have an agency that specializes in neuro wards, for example. Excellent. I love that comment. You want to be a neuro healthcare assistant. Yeah, exactly. Yeah, because the need is there and we're missing out on that need. We need to look at where the demand is by speaking to the multidisciplinary teams, finding out what the pressure points are for them. Because it's not just home care, it's not just in care homes. The hospitals have specialists as well that they are short of, and they need your help. There's your community as well. That will get awareness of you And then, you know, you'll get private clients. They'll be thinking, oh, that agency, they did some really good training the other day. I know, give them a call. Boom, you got private clients. So are you a warrior in your healthcare business? Let me know in the chat, are you a warrior? Because I'd love to hear from you. Because what we need to look at is how we can best serve those that need our help, whether it's in the community or whether it is in hospitals or whether it's with the NHS, for example. Where can you help? What specialisms can you provide? And I've given you a list of some specialisms, right? For example, the neurosurgeons, the service manager, the consultants, locums, mental health nurses. There's also scrub nurse, you know, theatre, false limbs. There's lots of different departments that are specialized. And you imagine you go to your community centre and you tell them that you are a care agency and that you specialize in dementia, for example. You could hold a training session at that centre where you ask the centre to ask people to come to your event. Whether you've got 3-4 people there, it's still raising awareness. And you know what? Even though you did it the once, don't stop. You do it again the following month. And then you go back again. Obviously you arrange the dates and times with the centre. And then you just keep doing that once a month. And then what's going to happen is that you will get clients that will come to you because they'll be like, oh, I know there's that agency, the one that does the training once a month. Family members, invite the family members, the carers that look after those that are vulnerable in their own homes. Invite them. Invite the service user as well, depending what, you know, how, what stage they're at, for example. That maybe you could help the carers become specialized in one thing at least for 2024. You could start a support group for carers at the centre, the community centre that a lot of people go to. And you could perhaps do, say, once a week for a couple of hours or 3 hours. You could do a drop-in where they could come in and talk and learn about different strategies that they could use, possibly. Or you could do a PowerPoint presentation. So think about that. You want to stand out, you want to be different for 2024. And to look at innovative ideas that's going to attract leads to you. Whether it's the carers, the family members, or a friend, it could be the centre itself that will recommend your organisation. They could say, this person's really good, they've been coming in here doing training every month or every week. Or you go and visit that day centre when they've got activity centre, when they've got activities, and introduce yourself, meet people. You know, if it's elderly, then you be there. If you're doing, depending what age group you're looking at delivering the service to as well. So if it's young adults, then you would be at that centre at that time, introducing your services. So the people in the community center, if you are, say for example, if you are qualified to train, you know, dementia, for example, then you train dementia. What is it are you qualified to train? Or maybe you just want to do a talk about your agency and that you are in this location and this is what we offer. And you know, you want to be able to support your community. And if that means you going in and helping, even say 1 day a week, helping with any of their activities, you can go in there and do some basic, simple activities, like, you know, bringing a say a basket with different balls in, and then practice that you could get them to do activities, or play cards, dominoes. There's different things you can do that's going to get you engaged with the community, and that's the reason why I'm saying this. You need to become engaged with the community, not distance, not disconnected from the community. What events do they have going on that you can attend where they're going to think, wow, I like this agency. The word will get around. You bring some cupcakes for those that, you know, it's safe for them to eat it, of course. You know, cupcakes with the teas that they hand out. What can you do? What can you, there's even care homes, for example. You could knock on the door of a care home and say, do you have an activity person? If they don't, then say, I'd like to volunteer and do activity services. It's free of charge. If you're good with a musical instrument, and I mean that you need to be good, then you could also go to your community centre and, you know, just perhaps play the guitar, play some old songs, even do this in a care home. When I had my agency, what I did was I was training in care homes way before I started doing my care agency anyway. But what I did when I had my agency is I said to the care managers, look, I'll come in, I'll do your free training, manual hand, because I was trained to do that. So I said, I'll do your manual handling, for example. I'll do your health and safety training, for example. And I did about 4 free trainings for them on the basis that you use me if you need someone. And that's what I did. And I got into the care homes. I got into one care home, and then that care home had a group of care homes. It was a private care home. So then I ended up, you know, in one building I would have 6 staff members in the same place. You know, 6 healthcare workers and 2 nurses, I believe, and then 1 nurse at night time. So if you can look at innovative ways that you can get your foot in the door, because you have to go out and meet people, let them know what it is that you do, and that you're not just the average Joe Blogs care agency. You want to be different. So that's another angle that you can use. Think about all the things that's innovative and that you can help transform people's lives in some way. Create an impact in your community. Say, hey, I'm here to help. What can I do to serve? You know, what other places is there that you can visit besides the community centre? There's age concern. There's dementia, for example. There's lots of different organisations. There's MenCap that you can go and see and tell them what you do. There's the cafes. You can use their cafe. Well, I don't know whether they allow it today, but you can use their cafe to do like a training in the evening, whether it's crocheting, because some people like to knit. If you know about knitting, if this is for the women, for example, you know about knitting, you could do a knitting class, then do a knitting class. Go into a care home with your needles and your, you know, your knitting needles and uh, your balls of wool, for example, and say, right, let's do a little stitch. Let's do a little round circle. What activities can you look at introducing? Because it's not just about you being specialized in that you're qualified to train in this, but you can also get in through doing activities, you know, and just going in just to talk, companion for someone who is just sat there by themselves and isolated. So what is it that you can do that's going to make you stand out? And I want you all to think about that very, very clearly and seriously. Look at this, because I don't know if anyone here is doing that. If you can let me know, it would be really good. Let me know if you're doing it and how it's working for you. I want you to try these methods. I'm not just saying it just for you to listen. I want you to try it and implement it. And let me know how that works for you. So what community centers are in your locality? Have an event. Create an event whereby you want to talk to the community to see what the need is. They will allow it because it is to their benefit. And you want to engage with the community. Don't just stay in your office and think you can just pick the phone up and call and call and call, and then you know you're just visiting care homes, but there's no other thing that's going to benefit them. What I mean, yeah, you're going to provide them with staff, but what else can you do that's going to help that care home? Good. I want you to do this. I'm going to do a video on how you do it as well, because I think that's important as well. I'll talk to you about how you should do it. Create yourself like some sort of, type up a document first about the activities, if you're going to do activities, right? Then, if you're going to approach a community center, you want to type something up first about the community centers. How many community centers is in your location? There's probably quite a few that specialize in different things, okay? Then you've got your care homes that need the activities, etc., or the free training, okay? List those care homes. And when you go to visit on that basis first, to serve them, okay? With your community, you speak with the community manager, let them know who you are and that you are wanting to get involved in the community and to help support the community, and that you want to hold a training or perhaps a one-day discussion about what the current need is in that location, or find out if they've got an event, weekly event, and can you come along to meet people, for example, and then explain what it is that you do. That is a really good way of getting out there in the community, because when you're running a healthcare business and you just started out, we tend to be static. We think we've got a mobile phone, okay, so the phone's going to ring, I know it's going to ring, and it doesn't. You know why? Because you didn't go out and meet the world that you're going to serve. They don't know you, but they will know you if you go out and visit. But you've got to create the documentation, you've got to talk to them in a way that you know that you're there to help them, but you need to know what the need is, because every location is different. When one location isn't the same need as the second location. So for example, what I mean by that is it could be dementia seems to be more prominent in one location, environment, for example, or it could be learning disability is more prominent in another location, or it could be another concern, which could be for young persons with mental health. So what is it that you can teach or talk and support your community with? Whether you go there when it's activity day and you join in and you speak with the people there, or you hold an event once a month and you're going to do a talk on a certain thing. You're going to find out what the need is. Let them tell you, let them guide you of what the need is. Say, hey, you know, I'm new here. I've set up my agency, my care agency, but I live in this community and I care about my community. What is the need? Like for me, I'll give you one great example. When I set up my care home in 1994, I prepared it the end of 1993. So 1994, I'll just drink my water quickly. I set up my care home on a council estate, and it was registered for 3 residents in Nottingham. And what I did beforehand is I spoke with the community. I spoke with the community with what they needed, but I also knew at the time, because my uncle had schizophrenia at the time, and I was trying to look for somewhere for him, and there wasn't anywhere that was small. They were all big, and I was like, no, I can't have this. That's just my preference. I didn't want to. I didn't feel good doing that. So I thought, I spoke with the social services. They told me, well, there isn't any that specialize in African Caribbean care home. So then I set up my first care home for African Caribbean, and I got full. As soon as I was registered, I was full because I knew that there was a need. I asked the community what they needed, what was lacking. But you know what? It wasn't just African Caribbean. It was all nationalities, because everyone wanted to be in a smaller home rather than be in a bigger home. So the niche was the small homes. So then I set up that home. It got full. I then turned my own house into a care home, which was right opposite the care home. You come out my gate and there was the care home in Nottingham. Set that up. That was full straight away. The need was there, but I knew that because I spoke with the community. I spoke with the multidisciplinary teams, and I was offering something different from the other bigger, larger care homes. Do you get what I'm saying? So I hope that you found today's training very helpful, because I want you to reach out and speak to your community. What is the need? What are they lacking? Remember at the beginning of this video, I said, what is the need? What are they lacking? i.e., what are they missing? What is it that you can offer that is different from the others? You got to stand out. You got to stand out. If you're looking at your agency, then what specialist services can you offer that's going to make you stand out as the provider. So like I said, the neurosurgeon at the beginning, remember? The neurosurgeon, service manager, complex care, for example. These are all high needs, or there's a pressure to get the staff because the staff are hard to get. That is the type of agency that you want to get in order to build a high level margin organization, as opposed to doing lower value contracts, for example. If you do this, you will almost collapse time for you to get to a certain level in your healthcare business. And I really wanted to reach out to all of you and tell you this, because this is 2024 and things have slightly changed a bit. We now know that we should work smarter, not harder. And I want you to work smarter, not harder, like how I did and my clients have done. You know, to me, it just brings me joy to hear that, you know, clients are actually working the smarter way and following the instructions as well. And I just want to give you that information that is going to take you to the next level in your healthcare business. And I hope that you'll be able to join us for we've got our brand new 5-day boot camp, and it's called, this is very new, okay, no one else is doing it. It's called Healthcare Horizon Boot Camp. We just finished our contracts boot camp last week, I believe. Okay, this is a 5-day boot camp. Okay, it starts March, but we're only taking applications only. Okay, because it has to be the right thing for everybody. It's got to be a good fit for you. It's got to be a good fit for us, because we need to be able to train and show you and let you implement. So I only want you to register for the free 15-minute consultation with me so I can talk to you. My team, you can put the link in the chat, please, and then I will discuss the dates once I've spoken with those that have booked a free 15-minute consultation, for example, because I need you to be able to do the work. This isn't a sit and watch type of boot camp. It's a boot camp. When you go to a boot camp, it's like if you're in the army, you're in the trenches, aren't you? You're climbing things, you're doing things, you're really working to a higher level, for example. And I need this participation in the boot camp. So this boot camp, it will be for 5 hours. However, you'll also get 10 hours on top to watch on demand at your own pace. And for the 5-day boot camp, it's $97. That's right, you heard me, $97. But I want you to book a free 15-minute consultation so that I can talk to you further about it, to see whether it's a good fit for you and see whether it's a good fit for us to be able to train you on this, because it is strategic. Okay, so I wanted to reach out to you and say that to you. Team, if you can post the link in the comments section here. So like I said, it starts in March. It's $97 because it is a special price, because it's completely new. And I want people to be able to learn new strategies. And I want it to be affordable for everyone as well. So what we need to also think about is, just go back a moment, yeah. So what we need to think about is partnership and collaborations. This, in order for you to grow, in your healthcare business, you've got to look at this. You've got to highlight, and you've got to look at who can you approach, who can you work with. Do research. Look at what other healthcare providers are doing. Do you stand out? Are you the lead now? Especially now you've got this information. But you also need to be using innovative solutions and improving patient care as well. So look at this diversification model and services. Okay, you want to look at offering to meet the needs of the community. You can be adding preventative care measures. You could do wellness programs. You could do chronic disease management services rather than the traditional care models. What else can you offer? Because if you can do that, you will stand out. It's time to be disruptive in a positive way. Stand out from the other agencies. Don't all do the same. Diversify your services. Look at expansion into new markets like what I've mentioned. Okay? You want to look at expanding into new geographical locations as well and demographic areas. You could even look at international expansion or targeting underserved communities to drive growth. There's lots of things that you can do that will benefit your organization, and you'll be known for that as well. You'll be known for that. So focus on sustainability. Okay? Look at you creating those models that I've mentioned. It will help you to get bigger. It will also help you to be sustainable. You'll be optimizing the resources that you have. And also look at implementing some green healthcare practices, which can also lead to cost savings and improve patient perceptions as well. So there's lots of things that I'm giving you here, okay? Because I really want you to really think and expand and grow, because this is what this training is about. And the podcast show is going to really cover more than this, okay? So look at how you can use the data and leverage it for your business, because you will uncover a lot of insights into patient care trends, operational efficiencies, and also what market opportunities that you could gain, and looking at guiding strategic growth initiatives. So that will be beneficial to you as well. Obviously, we've always got to think about regulatory compliance and adaptability. You've always got to stay ahead of regulatory changes and looking at adapting your business practice according to the compliance to reduce risk, and look at what opportunities that you can get as well with the new healthcare policies. Like I said, community engagement and health education is a real big thing now. It really is, and you as a business owner, a care provider, can implement this as well to get engagement from the community, because that engagement from the community will spread to the multidisciplinary teams like the social workers, etc., and they'll know you and they'll be like, hey, can I use your services? Hey, that was great. I understand that you're doing a talk on this day. Is it okay if I tag along? Actually, invite them all. Let them know that you've got an event and this is what you're going to be covering. Believe me, you will get some that will show up. So engage with your community through health education programs, outreach initiatives to build trust. Look at improving public health outcomes. You can mention the reason why you're doing this and establish your brand as the leader in the healthcare sector. Like I was many years ago, I was the leader because I did training. That was my strength. I was a trainer beforehand. That was my strength. And we delivered good care. That was my strength. And we also educated the care homes and the agencies, the community. Even we had the NHS staff come for training as well. Learn the 2% method. That's what you need to do. Forget about what the 98% are doing, because you know that 98%, they're working themselves very hard. You know, they need to really look at different methods, unless they're scaling and they've got the team members to do that. That's a different thing. But I'm just talking to those of you that want the 2% method, like what I've spoken to you about today. Then join me for the 5-day boot camp, which is about healthcare business growth. You'll also get as a bonus a section of the wealth management training. That's a bonus. And what I also want you to do is to look out for when my podcast show starts. I'm going to be sending out a live here on Facebook, letting you know that my podcast has started and the show has started. So do look out for that. I want you to also think about our podcast. It is about Beyond the Horizon. And it's about you living beyond the horizon and working towards living beyond the horizon. It's inspiring. It's an empowerment tool. And it's for 6-7 figure women leaders in global healthcare. Because I am a global healthcare strategist. And I help women to get their time back, their freedom, by using this 2% method. Because we've all been there. I did the 98% method. It only left me 2% to actually enjoy my life with. But let's switch that around. I want to say thank you so much, everyone. It's been such a pleasure being here, talking to you all. I hope that you've enjoyed today's training, and I hope that you've also really looked at this 2% method and how you can start implementing it as of like now. Get your notepad and paper out. Watch the video again if you need to. Let me know in the comments whether you're watching the replay or whether you're watching the live, and what aspects are you going to be implementing in your healthcare business. So thank you so much. Have a wonderful evening. Thank you for your time. I really appreciate it, because I know your time is valuable. But I hope that this has been helpful for you today. So thank you so much, everyone. Take care. Thank you. Bye.